Polycystic ovary syndrome, or PCOS, is a common hormonal disorder. It affects women in their reproductive years. PCOS is characterized by an imbalance of hormones. This imbalance can lead to a variety of symptoms. These symptoms often include irregular periods, acne, and excess hair growth. PCOS affects approximately 5 to 10% of women worldwide. It is one of the leading causes of infertility. Despite its prevalence, PCOS is often misunderstood and underdiagnosed. The underlying cause of PCOS is not fully understood. However, insulin resistance is a key factor. Insulin resistance occurs when the body's cells do not respond properly to insulin. Insulin is a hormone that regulates blood sugar levels. This resistance can lead to an overproduction of insulin. High levels of insulin can stimulate the ovaries to produce excess androgens. Androgens are male hormones. Excess androgen production can disrupt normal ovulation. This disruption is a major contributor to the symptoms of PCOS.
Diagnosing PCOS involves a combination of clinical assessment and medical tests. The Rotterdam criteria, established in 2003, are widely used for diagnosis. These criteria require the presence of at least two of the following three features: irregular ovulation, clinical or biochemical signs of hyperandrogenism, and polycystic ovaries on ultrasound. Irregular ovulation manifests as irregular menstrual cycles. It is one of the most common symptoms of PCOS. Women with PCOS may experience infrequent periods, prolonged periods, or even an absence of periods. Hyperandrogenism, another hallmark of PCOS, can manifest in several ways. Common signs include acne, hirsutism, which is excess hair growth on the face, chest, or back, and male pattern hair loss. Polycystic ovaries, the third diagnostic criterion, are characterized by the presence of multiple small cysts on the ovaries. These cysts are actually follicles containing immature eggs. They develop due to the hormonal imbalances associated with PCOS.
The short-term complications of PCOS primarily revolve around the reproductive and metabolic consequences of the disorder. Infertility is a significant concern for many women with PCOS. The irregular ovulation and hormonal imbalances can make it difficult to conceive. Menstrual irregularities, as mentioned earlier, are common. These can range from infrequent periods to heavy bleeding. Metabolic disturbances are frequently observed in PCOS. Insulin resistance, a key feature of the disorder, can lead to weight gain, difficulty losing weight, and an increased risk of type 2 diabetes. Hyperandrogenism symptoms, such as acne and hirsutism, can impact self-esteem and body image. The long-term risks associated with PCOS are more serious and far-reaching. Type 2 diabetes is a major concern. PCOS significantly increases the risk of developing this chronic condition. Cardiovascular disease risk is also elevated in women with PCOS. This includes an increased risk of heart disease, stroke, and high blood pressure. Endometrial cancer risk is another long-term concern. Women with PCOS who experience irregular periods or an absence of periods may have an increased risk of developing this type of cancer. Pregnancy-related complications are more common in women with PCOS. These can include gestational diabetes, preeclampsia, and preterm birth.
Managing PCOS effectively involves a multifaceted approach. Lifestyle modifications are often the first line of treatment. These modifications typically include weight loss through a healthy diet and regular exercise, as well as stress management techniques. These lifestyle changes can improve insulin sensitivity, regulate menstrual cycles, and reduce hyperandrogenism symptoms. Medical therapies play a crucial role in managing PCOS. Oral contraceptive pills are commonly prescribed to regulate menstrual cycles and reduce androgen levels. Metformin, a medication typically used for type 2 diabetes, can improve insulin sensitivity and lower androgen levels. Other medications, such as anti-androgens and fertility medications, may be prescribed based on individual needs. Surgical options are available for specific situations. Ovarian drilling, a laparoscopic procedure, can induce ovulation in some women. However, this option is generally reserved for women who have not responded to other treatments. Early diagnosis and intervention are critical for effectively managing PCOS and preventing long-term complications. By addressing the symptoms early on and implementing appropriate lifestyle changes and medical therapies, women with PCOS can significantly improve their chances of living healthy, and fulfilling lives.